Hello guys, good morning. We are here at the Flint station with a 35 degrees Fahrenheit temperature. And I'm excited to discuss with you how to decide if where you're gonna put your patient if he has something going on with his health.
May I have your attention, please? Customers track enrollment or connecting to the green and yellow line.
So about that, but anyway, stay tuned and let's roll on the logo. Before we continue, I would like to invite you to subscribe to my channel and then ring that bell button for more videos. Okay, let's go.
Doors open. Stand back to allow customers to exit. When boarding, please move to the center of the car. Doors open.
We are here. Brooklyn.
Doors open. Step back to allow.
Okay, so we are back. Just gonna step out of the escalator. Anyway, so I just decided to discuss with you how to decide where to put your patient, whether if it's a clinic or the emergency room. Because I had an experience when there's a family member that was asking me because he knows that I'm a nurse, and he was asking me, I have this patient here, and he has something going on, and I don't know where to put him. Can I put him on a clinic, or shall I send him to a hospital? And then sometimes the questions are kind of weird because it's sometimes it's really obvious that you have to send the patient to a hospital, and then sometimes it's obvious that you have to go to a clinic to be seen by a doctor. So that's why while walking here, I decided to give you a simple instruction or maybe a guide. So let's start. So one, if you have a patient, you have to check, and the guide for you is one, you have to start with ABC. A, airway. B, breathing. And C, circulation. Airway. So you go to your patient, see if there's no blockages. Sometimes there are children who are playing with their toys, and you don't know there's a toy inside their nose, or maybe they're choking, they swallow the toy. So something going on, check that one first. Secondly, you have to check if the patient is breathing. Check him, see if the chest is, or the abdomen is raising up and down. Listen to the breathing using your ear. Sometimes there their breathing that's really, you know, like a little bit of breathing, but they're still breathing, but it's, you know, it's faint. So you have to check 1, 2, 1, 2 and see if the patient has a heartbeat. You can check the pulse by you know, using the radial pulse in the hand, or just listen to the chest if they have a heartbeat. You'll see the patient is pale, or the fingernails are blue, so they're not breathing, there's no circulation there. So if you have that, send the patient to the emergency room, call 911. We're actually heading for a mass because it's Sunday. It's been years since I came in here. So another one, if you have a family or a relative in the house who had an accident, you have to check if he's alright, if he's alert, oriented, acting like good. Are you okay? Do you know who I am? Do you know where you are? What's the year this year? You know, just check if they're confused or not, or they can answer you. And then see where the injured part is. If you see there's a broken bone or whatever, don't touch it. And obviously, you know, you call for an emergency, send them to the hospital. And thirdly, see if your patient can still function. Are they able to walk? Are they breathing? Can they grasp something? You know, like you can take their hands and let them grasp you. If the strength that you know of the grasping is evenly, can they smile? Can they raise their hand? Sometimes they have stroke. You know, you don't know, especially if they have a history of high blood pressure. And if you have a high blood pressure patient, you know, check them. There's a lot of blood pressure machine that is available here. You can buy digitally. You don't really have to learn the blood pressure. Just put them in their arm, and then it's gonna check their blood pressure. So we are here. Let's attend the mass first. Okay, so that's the mass, and I thank God for the blessing that we received from Him today. And going back to the topic that I mentioned earlier, um, if you have a patient that had an injury, you see a broken bone, don't touch the patient. Just leave it alone. Especially if you really see that the leg is kind of like bended or the arm is bended, so don't touch the patient. Just wait for the emergency response team to arrive, because you might cause some more injury to the patient. And then for those who have paralysis because patient cannot smile anymore, history of high blood pressure, call 911, and they will send somebody to respond to the emergency. So that kind of cases are really for emergency room situation. And I would like to add, there's a lot of people who are diabetic, so it's either high blood sugar or low blood sugar. So the first thing you have to do is you check. And most of the patient that has a history of diabetes, usually if it's a child, parents usually are trained to check the blood sugar. So if it's low, they know how to use the injection, for the low blood sugar, or the glucagon. If the patient has reached they're like all lying down and they're not responding anymore, but then they're still awake, you go and get the diabetic candies that they can use, which was always recommended by the doctor. If your blood sugar is low, you use that one so that the blood sugar will go up to the normal level. And if it's the other way around, if the blood sugar is high, patient is vomiting, and parents usually knows how to check, let the patient pee, and then you have to check the urine for ketones. There's a strip that you will use. If it's high or positive, that means the patient needs insulin. So it's an emergency case too. It keeps on giving you a high blood sugar level. So to make it simple, if your patient is unable to perform normally, or they are unstable, they cannot do the normal thing that normal people can do because of the situation, there's mostly they need to go to the emergency room, call 911 and get help. Okay, so next topic. If your patient, family member, friend is still stable, they can still perform, and they just want to be checked, they have something going on, but then they think that, okay, I think this thing that I have needs to be checked, then that's the time you go to a clinic. The clinic has some basic amenities, but not all of it. A clinic can do emergency response, but then it's not really recommended. The emergency room or the hospital has everything, and you can be admitted right away if you need ICU, if you need to be in a surgery, it's there. But if you're gonna go to a clinic, then they can only do so much. Okay, so to finish my video, simple. If your patient needs immediate attention, they cannot perform normally, then go to the ED. And if they're stable and they just want to be checked, then you go to the clinic. So there you go. Hopefully I was able to give you some information. It's a simple one, but if you don't know what to do, you can always call. We're not really denying, questions, or if you need answers, then call anybody, any health care personnel, and ask them. They have an idea. We don't deny health care, or we don't deny questions regarding, health issues. So thank you very much, and I hope you enjoy this video here, even if I'm walking. Thank you very much, and have a nice day.
做什么？